The basis of the module was really the recognition that people who suffer a stroke do very much better in terms of recovery if they're managed in a hospital that has a functioning stroke unit. And the potential benefits of that are big enough to make it worthwhile really rolling this out as widely as possible. So that, in a nutshell, is why we really wanted to write this module, because the potential gains are big.
And so what are you actively doing with stroke units to spread them out across the UK and make sure that they are meeting all the needs?
I mean, one of the challenges is that most of the work done in stroke units has been done in wealthy countries, and with a complex package of care like a stroke unit, that makes it very difficult or challenging to translate it to other places. And so if you just think about it, you know, the number of staff, the training of the staff, the systems of care, the support services, you have all these basic components in place in countries like the UK and Australia. So it's been relatively easy to roll out stroke units in the UK. There's been a number of initiatives and it's happened. But the next frontier, I think, is how we move to countries where they don't have such wealthy healthcare systems. So middle and lower middle income countries. And so that's the next big challenge. Yeah.
And because you've had to roll out into, say, rural and regional areas, what kind of lessons have you learned about running stroke management units?
I think that the main lessons that we've picked up is that a lot of the benefits of stroke units are not to do with high technology. It's to do with staff doing the simple things well for everyone. So it's systems of care, it's training, and it's not even extremely specialist training, but you need to get, if you like, the elements of expert stroke care to every patient. And so that's where I think the real challenge lies now, in how to make that leap from very well resourced settings in big cities in wealthy countries through to, you know, places where staffing and resources are much more limited.
And how do you make that leap?
Well, in our module, we've speculated in a few ways, and they are experimental ideas just now. And one of them is the crucial people are the nursing staff. And so I think training and supporting nursing staff is number one. And secondly, in countries where the families come in and do a lot of care, it's going to be training and supporting families as well, if they're actually doing hands-on care. And thirdly, it's education. An awful lot of the things that we've learned about stroke care in the West has been relatively simple. You know, for instance, a lot of stroke patients have problems swallowing and are at risk of aspirating food and fluids. And you know, if you're alert to that, if you check for it, if you make adjustments for that, then you can improve people's recovery. So there's a lot of things to do around education and training.
So you talk about, you use the term systems of care.
Yeah.
So what do you mean when you say that?
What I'm really meaning is at the highest level, it would be the structure that exists. So you might call it a stroke unit, but as you drill into that, you get more and more detail. So what in fact it'll be is an area of a hospital where you have a team working who build up expertise in looking after stroke patients. And the things that they do, the routine things they do every day, that system of care is probably very important. Where some of the challenges lie is clearly it's a complex black box of care, and we don't know what the crucial elements are, but we do know that what should be in there, and we do know it's around education and training. So the module that we're talking about, the Essential Stroke Services module, is of necessity is very speculative, because we've not done research looking at implementing complex care packages into poorer healthcare settings. So it's quite speculative, but there are some excellent examples, South Africa, from India, where individual hospitals have done this without big budgets and have got measurable improvements in patient outcomes. So I think we're really encouraged by these anecdotal examples, and I think the future is to develop packages of training to allow us to roll this out in a more systematic way, and that's what we're working towards now.
So there has been little, you're saying there's little evidence in developing countries,
Yeah.
but the evidence that you've developed here in the UK has been going for how long? Like, how long have you been researching and looking into this?
We've been looking at the stroke unit trials for 20 years, and since then, since the sort of mid-1990s, there's been a steady increase in stroke unit availability. So there's been that relearning and implementing of the stroke unit package in the UK, and it's gone from being maybe, 1 in 5 hospitals having stroke unit to really almost all of them now. It's quite unusual for a hospital not to have a stroke unit. So there's been that huge kind of learning experience going on across the UK. Yeah.